Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to share with you 3 possible reasons why your knee replacement recovery is slower than you would like and slower than you anticipated. So these are just possible reasons. Again, everyone's going to be different and have different recovery rates, and that's perfectly normal and perfectly okay. But here are just a couple reasons why you might not be recovering as efficiently. So one is not taking the extra step outside of your physical therapy sessions. So for most individuals, almost all of us will have physical therapy twice, maybe 3 times a week for a good number of weeks after having knee replacement surgery. And the best thing that you can possibly do is listen to your physical therapist, listen to your surgeon and any other healthcare providers about what are the exercises you should be doing, what are the management strategies, so icing, maybe heat, whatever that may be. What are the things that you should be doing and need to be doing outside of your physical therapy to help with your recovery and healing after surgery? Just going to physical therapy 3 times, maybe about 45 minutes, an hour each session, 3 hours over the course of a full week is not going to be enough to fully help and optimize your recovery. You really have to take that initiative on yourself and be consistent, and that's with exercises, but that's also with doing the right things for managing, if you have pain or swelling, doing the right things to manage those symptoms, all of the things and all the education that you should receive through your physical therapist, through your surgeon, and any other healthcare providers. So that's number 1, is taking that initiative and making sure you're doing the appropriate things, not just when you go to therapy, but outside of therapy when you're at home as well. Thing number 2 is making sure you have realistic expectations. So some people, they'll go into the recovery process and they think that, I have 6 weeks or 12 weeks of physical therapy, and after that time frame is done, then I'm going to be completely healed, completely recovered, and feel 100%. And unfortunately for the vast majority of folks, that's just not the case. Knee replacement recovery is a marathon, it's not a sprint. Hopefully in those first few weeks, those first few months, you're going to see a lot of improvements, and hopefully you'll notice the improvements and the benefits, but you probably won't feel 100% or fully, absolutely recovered once you're discharged from therapy. There's going to be a time, maybe it's 6 months, maybe it's a year, maybe it's even a little bit more for some folks, till you really feel like you're fully recovered and fully healed. And in that same token, the amount of activity and what you're able to do after surgery, you want to maintain that realistic expectation. You're not going to be like you were when you were a teenager or 20 years old. You are, hopefully, and for most people, going to be able to do a lot more and participate and tolerate a lot more activities and things, but you're not necessarily going to be, running around on a soccer field or a football field or anything like that. So maintaining that realistic expectation that you're going to feel a lot better, you're going to have a lot more mobility, at least for the vast majority of people, but you're still dealing with, it's not your healthy, normal knee. It's still something new, and you're gonna have symptoms still, and it's gonna take a while to really get back into the activities you enjoy. Reason number 3 is the potential for having what we call fear avoidance. And what this means is, after having a knee replacement surgery, you may have some anxieties, some hesitancies to get back to doing the certain activities, the exercises, whatever it may be, that you would like to do or that you would normally do. And you may do this because of pain or symptoms, or you may be anxious that you may do this activity and it may cause this pain and discomfort and swelling, and it's obviously not very enjoyable. Or you may even feel that these activities, you don't want to cause any damage or harm to your knee replacement. And that's very reasonable thought process. This is a very significant thing to go through. It's a brand new knee, it's healing, it's recovering. I don't want to do anything that's going to cause any damage or harm. But what can happen is that thought process can get to the point where it's excessive and it's limiting your ability to get back to doing the things that you enjoy. I always tell people, think about if you had a healthy knee without knee pain or without any symptoms, what would be the activities? What would be the things that you would be doing? And then, look at that list, and if the things are reasonable, again, keeping those reasonable expectations, but, which of those things can I start trying to get back into? And you don't have to start, full throttle, 100% doing those activities, but what are some things that are similar, but maybe a little bit easier to start to build up to and start to get back into doing those activities? I talk about, for example, if you like to play golf, you don't have to go out and play 18 holes right away and walk the course, but maybe going to the driving range and hitting some balls a little bit is a good way to start to get back into that activity. So finding that kind of middle ground, that easier version of the activities that you like to do, and start to trust your knee and trust the knee replacement. It is very durable, it's strong, it's in there correctly. They have so much technology and so much innovations with knee replacement surgeries and surgeries in general that you can trust your knee. Not everyone has a perfect outcome, but the vast majority of people do have positive outcomes. So trust your knee and trust that it can handle your normal daily tasks. And then I'll just give a bonus one here real quick. The bonus one is you want to make sure you're considering your overall health, your overall well-being. So, a lot of times we're focused, we're tunnel vision on that knee, improving the range of motion, improving the strength, managing the pain and swelling, that we forget that the body is complex. The body has a lot of different factors and is dynamic and is interconnected. And so that if we neglect any certain part of our health, then it's going to have consequences on other things, and especially healing from a significant surgery. So things like, are you getting enough sleep? Are you eating healthy? Are you staying hydrated? Are you taking care of your mental health and mental well-being and managing stresses in your life, if that's from work or if that's from a family, whatever that may be. So make sure that you're looking at your overall holistic health and well-being as well, and making sure that those things are in check and are doing well is going to help with having the most efficient recovery and the most optimal outcome from knee replacement surgery. I hope this provided some useful insights. Be sure to leave a like if it did. It helps share this videos with others who would benefit. Be sure to leave your comments and questions below, and please subscribe if you don't already, and turn on the notifications if you want to catch all of our videos related to knee replacement surgery, frequently asked questions, exercises, rehab, recovery, preparation, and everything else. Thank you very much for watching.